Hey everyone, Alex here from Rowan Health and Wellness. Today I'm going to talk about nails. Gentlemen, this also applies for you. But our nails are a way that actually sometimes is our body telling us early indicators that things are going on with our health. So just by taking a look at your nails, it might be your body's way of showing you early signs of things that are kind of going on the inside. I'm going to run through a few of them. These are kind of more the popular ones. So everybody, nails out. Taking a look. And what it might mean for your health and things that might be early warning signs that you can take action on sooner rather than later. Nail pitting. Looks like little divots, little like they've been tapped. Got little indentations, little grooves going on there, little dips and dents. Most commonly, you'll see this in people who have things like psoriasis or psoriatic arthritis. It can also be related to connective tissue disorders, such as Reiter syndrome or alopecia. So if your hair is starting to thin and your nails start to have some of these divots in it, it might be the early signs that you have alopecia. Take a look, take a peek. I actually noticed I'm one of those people who have psoriasis. I had it since my teen years, and my nails for a while I just thought that was the way they were, realized those are actually a connection to that whole process going on in my body. Spoon nails. So when the edge of the nail is just kind of turned up instead of kind of going out, and it kind of curves up a little bit like a scoop or a spoon, it's actually a sign of iron deficiency and early signs of heart disease and hypothyroidism. So if you have those really kind of fragile scoop spooned fingers, and I have had plenty of patients over the years who do have diagnoses of all of these things, the iron deficiency, heart disease, and hypothyroidism, and a great deal of them do have that little scoop. So if you take a look and you've got that going on, and you have some trouble with fatigue, with maybe some weight gain, maybe you have trouble with the cold, a lot of these are also signs that you might see for early indicators of both iron deficiency and hypothyroidism as well. So take a look, might be worth further investigation. Yellow nails, whether it's, and this applies for your toes too, but yellow nails on the hands or on the toes, usually they'll have a bit of a detached, they start to lift a little bit at the edge. Sometimes there's a bit of pain that comes with these. It can be a sign of either a respiratory trouble, so breathing troubles such as chronic bronchitis, they'll have these kind of changes. It's also patients, if you have a bit of swelling in your hands, you might have something called lymphedema, which is issues with your lymphatic system and how it drains. So it tends to also lead to some of these yellow nail looks. The other thing that also can be in here is yellow could be an indication of a fungal infection. So usually there's one or two nails that seem to be worse than the others that it starts from, but keeping in mind if you do have yellow nails, it might be worth a take a look at something like a fungal infection. If you're a smoker, that probably would also explain. Usually it only restricts to the fingers that will hold the cigarettes per se, but that's the nicotine affecting the growth of your fingers on those nails. Clubbing. Usually once you get to the point where you're clubbing, it's a fairly significant health concern. And a lot of the time, so it's right at the tip of the finger, the nail will actually start to curve down. And your finger as a whole actually at the tip will get just a little more wide and plump. This usually will take years. It goes through phases of slight changes all the way up to it being very, very noticeable. Like I was at the grocery store the other day and there was a gentleman ahead of me and he was cashing out and I looked down at his hands and I was like, you have heart issues because of how distinct his clubbing had been. And what happens that causes this is actually low oxygen in the blood. which can come from a number of things, which could be lung disease, inflammatory bowel disease, cardiovascular disease, liver disease, or AIDS. But a lot of the time it is that cardiovascular that I've seen myself. But it goes down to the fingertips not being well perfused and getting that oxygen to them. So Terry's nails. So this is where the tips of the fingers are dark, but the rest of the nail is kind of like a pink. You can kind of see pretty nicely on this one. You get the dark kind of band at the end, and then the lighter pink down here. Sometimes it can be attributed to age, but if you're someone in your 40s and 50s and you have this appearance to your nails, it can also be a serious sign of things like liver disease, heart disease, and diabetes. So take a look there. See, it doesn't always have to be that perfect band either. It can be a little bit of an abnormal look to it, but somehow a portion of the nail, the end of the nail, will be darker than the rest. Beau's lines. This is where you get an actual dent that runs across the entire width of the nail. Unlike pitting, where it's like little spots all throughout, these are very distinct rows. They sometimes will show up when the growth of the area under the cuticle has been interrupted by serious injury or illness. But there are some instances where it might not be so blatantly obvious that there's been a severe disruption, like an infection or an injury. It might be something like uncontrolled diabetes or peripheral vascular disease, so poor circulation. Conditions that usually have a high fever, it will be a part of, or signs of zinc deficiencies. So if you haven't had high fever, you don't have diabetes, and your circulation is fine, but you have these little dents through your fingers, it could very well be a sign that you are severely zinc deficient. So take a peek at that. Do you have speed bumps on your nails? Onycholysis. So this is where the nail kind of is abnormally retreating almost. So you get, sometimes it's not full breakage, but you get kind of where the white at the end expands down the nail and it actually starts to lift a little bit. Usually this is from an injury. If you can't explain the injury, like you smashed your finger with a hammer, again, it's along those lines of an infection, most likely a fungal infection. Other things that can bring this on, though, are nail hardeners and adhesives. So if you get your nails done a lot, it's your body showing that it's not really recovering well from having that on it, and it's affecting the growth of your nails. If you don't get your nails done and you haven't injured it of recent, it could also be a side of thyroid disease and psoriasis. So I myself with psoriasis haven't had this part. I just have the little dents that came with it, but I didn't have the full echinosis. So along those lines, so this is a nice quick kind of just to let you know there are things that are going on in your body that give you those early warning signs that there is something serious happening in your body with something inside. Your skin is also a great indicator. So if you have things like psoriasis, eczema, rashes, yeast infections, you have a bit of a yellow tinge to your skin. These are all signs that likely something's going on inside, and this is your body showing you on the outside. So skin and nails are very important to take a look at. Again, if you have any further questions on any of this, please feel free to reach out to the Rowan Health and Wellness Clinic. And on that note, I wish you guys health and happiness.